Welcome to the Johns Hopkins Hospital. We know you have a lot of decisions to make right now, so we're here to make one of those as simple as possible. We're going to help you and your family become more familiar with our facilities so you know where you're going and what to expect upon arrival. When you arrive at the Johns Hopkins Hospital, we encourage you to park in the Orleans Street garage that's connected to this building by a bridge. If you are in active labor, we have valet parking at our main entrance, or you may leave your car at the entrance briefly to be escorted in. The car will then have to be moved to the Orleans Street garage. Once you cross the bridge, you will look for the green elevators. The birthing center is located on the 8th floor of the Sheikh Zayed Tower. Those of you who are Johns Hopkins patients have already received our Journey 1 book from your physician. Please refer to this book throughout the tour, and it will give you important information about visitation, parking, and other details for your time here. Let's go on up to the 8th floor. When you arrive on our unit on the 8th floor, you will come to our security desk. Any visitor that you want to visit you in the hospital will need to show photo ID to gain access to our unit. The unit has a total of 35 rooms, including triage rooms, postpartum rooms, antepartum rooms, respite nursery, lactation consult rooms, and more. Our 6 triage rooms, which are separate from the labor and delivery rooms, are all private with private bathrooms. Our state-of-the-art operating rooms are located right down the hall. The PACU, which is right next to the nurse's station, has 3 beds, and you can keep your baby right there at your bedside. So now let's take a look at one of our labor, delivery, and recovery rooms.
We are standing in a labor, delivery, recovery room at Johns Hopkins Hospital. My name is Ellie Aid. I'm a clinical nurse for the obstetrical department. I'm also a certified childbirth educator. A labor, delivery, recovery room is a room where a woman spends most of her labor. It's where she gives birth, and a room that she stays in for 2 to 3 hours after giving birth. Those first couple of hours of getting to know a newborn happen right here in this space, an opportunity for pictures, video, celebration with family and friends. We have a total of 10 private labor, delivery, recovery rooms. They're all connected to a private bathroom. We also have a birthing ball that can be brought into the bedside. We have birthing bars that can be attached to our labor beds in case a woman would like to squat during her labor or while she's pushing. An infant warmer is available, a bright place for a baby to have a physical and a bath, any emergency oxygen, suction, equipment that we may need for any unexpected or expected baby emergencies that may happen at the time of birth.
During your labor and delivery, you will be monitored around the clock. The Birthing Center's team room provides a centralized location for your doctor, nurse, and other providers to stay informed real time.
Hi, I'm Nancy Hipshin. I'm a maternal fetal medicine specialist here at Johns Hopkins. Here in the team room, we hold multidisciplinary rounds, both in the morning and the early evening. Multidisciplinary team rounds include members of the physician team, as well as the nursing team, often members from social work and from the NICU team, the Neonatal Intensive Care Unit. This affords an increased level of patient safety. In addition, the nurses and the physicians must all be certified in fetal heart rate monitoring. We have the ability to monitor what is going on in any patient's room in terms of both the infant and the mother from any point in our unit.
After your delivery, you will be moved to the west side of the unit and into one of our postpartum rooms.
After your delivery and everything's medically stable, you and your baby will be brought over to your postpartum room. We have 35 all private postpartum rooms, so rest assured that you and your family member will have a private room. Our pediatric nurse practitioners, or PNPs as we call them, they will be in to see your baby. They'll round on your baby every day and do the assessments on your baby that are necessary. They'll also help you set up those important first visits with your private pediatrician once you leave the hospital. If you've had a vaginal delivery, you'll stay 1 to 2 days. If you've had a C-section, you'll stay 3 to 4 days. There's always room for early discharge if you're interested in that. You just need to be talking to your nurse and your doctor prior to that time so that we can make appropriate accommodations. We do practice complete mother-baby couplet care here at Hopkins, which means you get to keep your baby in the room with you the whole time. If you want no separation, we can do that for you. There's no reason that the baby has to leave your room to go to the nursery, unless of course you want that. Some moms just say, give me a few hours, I'd like to take a good nap. Our television programming here at Hopkins, also called TigerNet, provides the patient with education. We also obviously have the entertainment channels, and you'll be able to surf the web. We have what's called at your request service. You order your food and it's delivered in a room service style. Visitor trays are available for a nominal fee. Visiting hours here are from 10 a.m. to 10 p.m. You are allowed to have one overnight guest with you while you're staying. Any sibling to the baby is allowed in to visit while you're here in the hospital as long as that sibling is at least 2 years old. Any other visitors need to be at least 18 and above. That changes during cold and flu season. During cold and flu season, we do restrict visitors to the age of 12.
My name is Catherine. I am one of the lactation consultants here at the Birthing Center. Our lactation services start during your prenatal care, where you can sign up, and we encourage you to sign up for one of the lactation classes that gives you some of the vocabulary that is going to be used. We talk about positioning, we talk about some of the goals of breastfeeding, and address some of your concerns and hopes and fears prior to even having the baby. All of our bedside nurses are trained in lactation support in accordance with baby-friendly standards. We work constantly to keep you and your baby together, and it is that mother-baby shared time and bonding and close association that facilitates breastfeeding in this postpartum environment. We want you to feel supported during your pregnancy, during your stay here in the hospital, and after you go home, knowing that we are available to answer all of your questions and help you to achieve the best possible outcome.
Throughout the unit, we have family nourishment centers where you or your family members can take a break. We offer coffee machines, refrigerators, ice machines, and microwaves. We hope you've enjoyed taking this tour with us. This is a very exciting time for you, and we're here to make this journey as special as you've always hoped it would be.